I'm Christian Schaffer. Welcome into the special Facebook Live discussion here. May is Stroke Awareness Month in the United States, and I'm joined by Dr. Oluwatosin Thompson, who is from GBMC Health Partners, a neurologist.
Yes.
And thanks so much for coming in.
Thanks for having me, Christian.
How long have you been with GBMC now?
About a year now.
Only a year?
Yes.
So pretty new to Baltimore.
Oh, yes.
But
yes.
in that time, there's already been a lot of patients that you're dealing with at a busy practice.
Yes. Yes, lots of strokes out there, lots of neurologic issues out there that need figuring out and treating, for sure.
So the patients that you deal with have, in many cases, already had a stroke, and you're working with them to try to make their life better for them and their families.
Right, certainly. Many of them see me in the clinic setting have already had a stroke, or at least are a high risk for having a stroke. So I bring them in, evaluate them, and try and find ways to either prevent one from happening or at least prevent another one from happening. So that's mainly my job.
So just back up for the viewers real briefly. What exactly is a stroke? Why and how does it happen?
Excellent. So there are two main types of stroke. By far the most common one, Christian, is called an ischemic stroke. Essentially what that means is that a certain blood vessel and that feeds a part of the brain becomes blocked, and the function that part of the brain serves is lost, and that essentially is the ischemic stroke. Yes, and then the second most common type of stroke is called an hemorrhagic stroke, meaning a blood vessel has burst, causing blood to pool in part of the brain, causing irritation and loss of function.
And it may go without saying, but the brain needs to be fed with fresh supply of blood constantly at all times.
Yes, it needs that.
And so when that's interrupted, problems can develop pretty quickly.
Absolutely, yes.
And that's what happens with the stroke. So how common are they? And the patients that you deal with, it sounds like there's a lot of them.
Yeah, so unfortunately, strokes are quite common. According to the CDC, stroke is the fifth leading cause of death in the United States. And every year, about 795,000 people in this country will have a stroke. So lots of people who need to hear this message and hear about it and figure out ways to prevent it. It's very important.
When we hear of an issue with the brain, I mean, it just on its face, it's very serious, and it's also very sudden.
Right.
You don't necessarily know it's going to happen, and when it does, what exactly to do about it. So it may be important for people to talk about ways they can prevent it from ever happening in the first place. What are some of those ideas?
Yeah, so I think the first thing to start with is, of course, knowing what your risk factors are. In this country, the most common stroke risk factors include high blood pressure, diabetes, high cholesterol, smoking, and certain heart rhythms such as atrial fibrillation. All those put one at increased risk of stroke. So it's very important, of course, to work with your doctors to try and prevent whatever risk factors that you may have.
It sounds like some of the risk factors for other types of problems, health problems that come from an unhealthy lifestyle can also lead to a stroke.
Absolutely. Just like I mentioned, those things like smoking, high blood pressure, diabetes, the kind of diet that you have, obesity, all those things does put one at increased risk for stroke.
Just a few weeks ago, last month, well-known director John Singleton died after having a stroke.
Right,
and he was just 51 years old when it happened. And I think that took a lot of people who aren't in the field by surprise just because of his age.
Right.
And but that does happen.
Yes, I mean, stroke is really does not discriminate. It's no matter what social status you are in, what gender you are, it can affect everyone, even age-wise, to affect everyone and anyone. So it's really important, once again, to know your risk factors and to work with your primary care doctor to control and minimize those factors.
In your practice, and you see patients who've had a stroke, can you talk a little bit about the impact that must also have on their immediate family members? If you have a husband or a wife who's had a stroke, that's going to change your life too. What are some of those impacts that you've seen?
Yes, so we know that stroke is a major cause of disability in this country. So, and depending on what part of the brain the stroke affects, depends on what kind of function can be lost. Commonly we know it can cause weakness, loss of sensation, but can also cause even other issues like loss of ability to express oneself or understand the language. And of course that can be really a lot of work to manage at home. And really it's important that whatever caregiver out there is in a good relationship with the primary care doctor, a neurologist, therapist. All those things help in this process of healing and managing.
When we fall down and bang your knee and cut it open, it gets better. Is the brain like that? Can it repair itself?
Yes, so we have the saying in the stroke community, time is brain. And that means the more time it passes before one stroke is evaluated, the more chance there is that more brain and more function can be lost. So certainly, especially in the acute setting, when someone is worried that they may be having a stroke, it's so important to seek immediate medical attention, because the more time passes, the less unfortunate chance there is of full recovery. So time is of essence in those very early stages of symptoms.
So the problem inside of the brain is spreading as the stroke.
Essentially, the way I see it is, if you can address the problem quickly enough, there's a chance that the function can be recovered. But the longer time passes, the more chances that the function at that part of the brain that's been affected may not be recovered.
And so in those cases, you're having to help a stroke victim, manage and find other ways to go forward.
Right, exactly. And we're hoping to pull people away from there. We're hoping it doesn't have to get to that place. We're hoping to catch more people in the acute setting and treat them, because there are treatments available out there if it's caught early enough, increasing the chances for full recovery.
And if someone has had a stroke, are they more at risk of having another one just because of the previous risk factors or something else? Like, is it more common to have a second one later?
Absolutely, yeah. So we know that having a stroke does increase one's risks to have a second one, and on and on. Like you said, Christian, part of that is just the risk factors that you already carry does increase your risk for more strokes. And of course, already having one increases your risk for more too.
So you are in your home with your loved one, and you may notice something is wrong. How do you tell, or what would lead you to suspect that your loved one might be having a stroke?
Great question, Christian. So the main signs and symptoms of a stroke include loss of sensation in a part of the face, arm or leg, loss of strength in face, arm or leg, difficulty speaking, slurred speech, or difficulty of that loved one understanding what people are saying to them. All those may indicate that your loved one or yourself may be having a stroke. Yes.
So, and you mentioned the type of stroke that sounds like a blood clot. Those can happen in other parts of the body. Is it just more serious because it's happening inside of the brain, or does it happen more often because of the structure? Talk about why it seems to happen, and strokes seem to happen as opposed to blood clots in other parts of the body.
Right, so really a blood clot to a blood vessel can occur really anywhere there is a blood vessel in the body. With the brain, time is really of essence. The more time passes, the less chance there is of full recovery. And the brain can really, is really the control command center of everything. So really preserving its function is really vitally important.
And so when it starts to be lost, that leads to other
disability.
problems.
Yes, absolutely, it leads to disability.
And can you just talk a little bit about GBMC and whether the emergency department there is equipped to handle someone coming in with potential signs of a stroke? I mean, we tell people, even on the news, there's people who use the emergency room too often for problems that aren't necessarily so serious. But in this case, it sounds like you want to get people in as quickly as possible.
Absolutely. Like I said, Christian, time is brain. The more quickly you can get to an ER, the greater the chances are for full recovery. So I tell all my patients, if you are worried you may be having a stroke, or you're worried your loved one is having a stroke, call 911. Don't take an extra aspirin. Don't try and sleep it off and wait to see if things get better. Pick up the phone, dial 911, and get brought to the ER immediately. GBMC's ED is very well equipped to both diagnose, evaluate, and treat patients who are deemed to be having a stroke. I mean, it's very well equipped.
With May being Stroke Awareness Month, that's the main thing we need people to be aware of, is that if they are seeing this issue happening, that it needs to be addressed as quickly as possible.
Absolutely, time is brain, Christian, right away is very important.
So among your patients who have had a stroke, is there something that is common amongst all of them for treatment, or do you have to tailor it individually to each different patient?
Certainly, as with anything in medicine, and everything has to be tailored to each situation, each patient's needs, and of course sometimes even and often their desires too. With strokes, especially with the kind of stroke caused by a blocked blood vessel, there's a medication called TPA, clot-busting medication, that can be given. This medication has to be given within 4.5 hours of onset of stroke symptoms. Another reason why time is really of essence. One has to get to the ER right away to receive this medication. And so that's one common way of managing and treating strokes, and that has been shown to really increase the chances of recovery, meaningful recovery.
And Alexa's asking about the symptoms. Again, just so you can run down some of the problems that people might notice that might come together to make you think, oh boy, I got to call 911 right now.
Yes, so once again, it's difficulty in speaking, difficulty understanding what people are saying to you, weakness or numbness in the face, arm or leg, all of these, loss of vision, these are all signs that you may be having a stroke.
Could it be something else? And then you wind up getting better news than that.
Exactly, and I feel if it was my loved one, I'd rather they go in and be told that it's something else as opposed to staying at home and then unfortunately losing that brain function.
Right, and not having the answer right away.
Right, exactly.
So as far as the treatments, does it involve physical therapy, things like speech therapy, right. And can a stroke victim, improve those characteristics over time with work?
Absolutely. That's why the therapists are really an integral part of the treatment and management of stroke patients outside the acute setting. The speech therapist, the occupational therapist, the physical therapist, they're very important in both improving and optimizing both the swallowing function and dexterity and mobility for stroke patients.
Wow, swallowing. So it affects a lot of things that we just take take for granted as normal.
Exactly. It's affects so much, and that's why I always say, prevention is really the most important thing. And if we get past prevention into someone actually having a stroke, then time is probably the second most important thing in that situation.
So the ways to prevent it then are in advance
Yes.
with attempting to make a healthier lifestyle. Can it be genetically? Like if you had a relative who had one, could you also have a stroke or a more risk of a stroke later?
I think very rarely there are those genetic causes for strokes, but by and large in our country, these are things that are preventable: high blood pressure, diabetes. Things are preventable and or treatable. So high blood pressure, diabetes, smoking is a very common cause for strokes. High cholesterol. All these things are things that can be managed and treated.
And I'm going to put you on the spot here too with this one, because a lot of people wonder about smoking. You think lung cancer,
right.
But it also impacts other parts of your body and other systems that can lead to a really serious problem like a stroke.
Yes, absolutely.
How does that work?
I mean, smoking affects everything, but stroke-wise, it increases, the rate of plaque formation. It causes, which can, of course, lead to blocks in the blood vessels, which cause ischemic strokes. Yes, very important.
So that is a serious problem, and one that someone could address.
Yes.
Over time
by seeking out help,
help.
to quit smoking. Very important.
And some of the other issues they could address are things that they could be doing with their regular physician,
Yes.
On their regular doctor visits to lead a healthier lifestyle.
Yes, it's so important to really build a trusting relationship with your primary care doctor to really manage these conditions going forward. All the common culprits: high blood pressure, diabetes, high cholesterol. All these things are things that really, with cooperating with your primary care doctor, can be managed effectively.
Yeah, we're joined here by Dr. Oluwatosin Thompson from GBMC Health Partners. He's a neurologist and he's relatively new in town, but already a lot of patients, just because this is such a complex problem and one that's experienced by a lot of families in our area.
Right.
And May is Stroke Awareness Month, so we're just trying to get the information out about what people need to think about as far as getting that risk factor down.
Right.
Is really the key, because there's not much you can do to directly prevent a clot from forming in your blood, but you can get those risk factors down.
Absolutely. Prevention is always much better, by working with your doctors to control those risk factors: high blood pressure, diabetes, high cholesterol, smoking. All those things are very important. in the long run, not just for stroke, but for general health, but in this situation, also very important.
Do you can you describe any of the success stories that you've seen as far as people whose lives are improved through treatment even after they've suffered from a stroke?
Absolutely. So many cases that I get to witness. People will come in with strokes due to a blocked blood vessel, and then they get the clot busting medication, and in 50 years ago they may have been really walked out of or left the hospital with huge deficits, but these people get to walk back home almost as if nothing happened. And that's really modern day medical, really in a sense a miracle, and we're so glad we can offer that to people. But once again, it's really important that people understand that it's a time sensitive thing, so the medication can only be given within 4.5 hours of getting to the ER. So important to get there, call 911, get there right away, and get evaluated.
Do you think most of the research in going into preventing strokes and treating stroke is focused on different types of medication like that, or is there other types of treatments that are available, or is that where researchers are looking into trying to even further impact people's lives?
Right. So we know that, of course, prevention is really where the highest impact will be. But lots of research is being done for other things that can be done, even outside the clot busting medication. Now we have procedures that can actually go in and reach and essentially fish out the clot in the blood vessel and reopen that blood vessel, for blood to flow and blood to get to the part of the brain. And so that's also another thing that can be done too. And lots of research is being done into, sort of the best time periods for those things and what kinds of patients benefit best from those procedures. But I think really the take-home point is that, stroke is really, by and large, very preventable. And it's really understanding those risk factors and managing them that really brings about the best outcome.
And we've talked about people who are younger potentially getting or having a stroke, but does that risk increase as a person gets older?
Yes, so age is another risk factor. Unfortunately, we can't do anything about that yet. But
I like the yet.
It's a risk factor for stroke. So the older we get, the more risk there is of stroke. But stroke can affect anyone and everyone at any age. Certainly, the causes for strokes in the young population is a little bit different than what we see in the older and middle-aged
How so?
people. So typically with younger people, it can be due to injuries, so accidental injuries to the neck, to the blood vessels in the neck, can cause problems and strokes. Yeah.
Okay, so that's another potential issue. If someone has had an injury, they should be thinking about that. And just before we let you go, just talk one more time about some of the specific things that people can do, even at a younger age.
Right.
Better to start making lifestyle changes earlier, I would think, to prevent this problem from happening in the future.
Yeah, so really it's all about self-care, healthy lifestyle, making good, healthy diet choices, making exercise, leading an active life, making all that a part of your life. All of that goes a long way to protect your general health and, of course, reduce the risks for problems down the line, such as strokes.
Okay, Dr. Oluwatosin Thompson, thanks so much for coming in here to the studio to talk with us on this important subject, stroke. Very common in the United States, more than 800,000 every year. So this is a major problem, but it's something that can be addressed, can be treated later, but it's better to try to prevent it earlier.
That's right.
Okay,
That's right.
Dr. Thompson, thanks so much for coming in. And thanks to you for watching us here on the WMAR2 News Facebook page. We'll have another live interview with GBMC next month, but thanks so much for coming in.
Thanks for having me, Christian.
I'm Christian Schaffer. Have a great day.